Good morning, everybody. Trying to see you all right now. There you are. Okay. We'll get started very shortly. We'll just finish letting everybody in. I hope you're all well this morning. So we have wonderful Charlotte Hunter here with us this morning, who is going to be letting the rest of you in, and will also keep an eye on the chat for us, because for some reason I can't see the chat today. Please feel free at any time, by the way, to come off of mute and contribute, ask any questions. You're very welcome, if you don't want to come off mute, to pop your questions in the chat as well, and we will tackle those as we go. And we'll get started very shortly. Okay. I've got the chat now, but I've not got your faces. So I'm just going to have to imagine you all there in front of me. Okay, so what are we? We're 3 minutes past 10. So I think what we will do is get started. So good morning, everybody, and thank you for joining us for this morning's webinar. Today, we're talking about investigating leaky gut and testing the gut barrier. And I can see actually that some of you have joined us today who were with us at the Gut Protocols event in London last weekend. So lovely to see you again. Some of the things that we go over today will be fairly familiar to you, and some of the slides might look familiar too. But this is an opportunity to re-go over everything, talk a little bit in a little bit more detail, and also be able to ask any questions. So if we get started then, in terms of what we're covering today, well, first things first, I don't want to teach you to suck eggs, because you are all practitioners on this webinar, but we will just have a very quick recap of leaky gut or intestinal permeability to set the scene. We're going to talk about how to test the gut barrier. We're going to talk about the food sensitivity gut barrier connection and where its relevance is in testing. We'll talk about gut barrier markers, and then we're going to go through some real life client reports, some actual gut barrier panel results. Before we get started, you may see some of them on the webinar today, but this is our little KBMO UK team. We have Charlotte, as I mentioned, on the call. She's going to be keeping an eye on the chat for us. She's our head of KBMO UK. We also have Lynette in customer service. You may have well spoken with her before on email or otherwise. She's the one that makes sure that your clients' tests get off to the lab and go where they should and that sort of thing. Kelly, you will have possibly met at events with us. Claire is our ops manager. Natasha looks after our practitioner relationships, so you may have also spoken to her. And I am Emily Birch. I am support and communications with KBMO UK. So let's start to talk about the gut then. So talking about the gut and gut testing and gut permeability, all things gut, it would be remiss of me to not mention this quote from Hippocrates, which I'm sure we've all seen hundreds of times. All disease begins in the gut. And we are going to expand on this today. For those of you that are watching the webinar rather than just listening in the background, This image is really not great quality, I admit, but I wanted to put it in there really to inspire you to go and have a look at it because it's a great image. You'll see the study that I got it from at the bottom there, and really just alludes to this fact that all disease begins in the gut, talking about the health conditions associated with the gut-brain axis, the gut-heart axis, the gut-bone axis, the gut-liver axis, and so on and so forth, and really bringing us back to that place of understanding. But what about the intestinal barrier then? Let's talk about that because that is the part of the gut that we're talking about today, or the GI tract. So the intestinal barrier then, as I say, very, very quick recap on this. It's the first line of defense against pathogens and food antigens. And as you know, in a healthy person, it operates on selective permeability. And what that means is that water, ions, low molecular substances can freely pass through this barrier, but larger molecules, toxins, food allergens, and pathogens can't. When, however, the latter do permeate, God, I need to put my teeth in today, don't I? Permeate the intestinal barrier, the immune system is overactivated. And what happens then is essentially a systemic inflammatory response. And this is why maintaining the integrity of that gut barrier is absolutely key for your client's well-being. So what happens then when it becomes permeable, when it becomes leaky? Well, this is a really, really great visual of essentially what leaky gut means, what intestinal permeability means. And essentially what it is it's where the lining of the small intestine becomes damaged and more porous. This allows the toxins, bacteria, other particles to leak, hence leaky gut, into the bloodstream, which, as we say, contributes to excessive immune reactions. It triggers and mediates systemic inflammation, not good news. And this in itself is associated with a wide range of symptoms that you see in clinic every single day. So these are symptoms such as food sensitivities, bloating, fatigue, headaches, joint pain, skin issues, nutritional deficiencies, and a whole range of other symptoms, as I say, that you tend to see very regularly. I've put a little reminder down the bottom here, and I think it's important for us to remember ourselves, but also remind our clients when we're talking to them about this sort of thing as well, that a level of intestinal cell permeability is completely normal. Intestinal permeability in terms of transport of substances across the cells, completely normal, totally needed for nutrient absorption. But leaky gut, as we're describing it and looking into it here, involves compromised epithelial tight junctions. So it's where those tight junctions are moving apart. And I think it's really, really important that we just define the difference. So that is our speedy recap of the intestinal barrier and intestinal permeability and what leaky gut is. So let's get into how we test it. Well, first things first, it can be tested and comes as standard with the KBMO food inflammation test, so the FIT test. And I guess some of you might be thinking, well, why? Why do we test the gut barrier as part of a food sensitivity test, food inflammation test? Well, as we've already alluded to, some of the molecules that shouldn't cross that gut barrier are larger food protein molecules. And as a result of that, the food sensitivities themselves are often associated with leaky gut. The two very, very often go hand in hand, as Dr. Joel Evans says. The immune complexes and inflammation associated with foods are an underlying problem for all of the conditions that he sees daily, and he should know. Those of you that aren't familiar with Dr. Joel Evans, he's a functional medicine educator. He is a board certified OB-GYN and an international lecturer, and he is a founding diplomat of the American Board of Holistic Medicine. So he knows what he's talking about. And the thing is, and this I have to credit Charlotte here. This is Charlotte's favourite slide, and for great reason, actually. Food sensitivity or leaky gut, which came first? Well, when we talk about those food molecules that are crossing the gut barrier that shouldn't, as well as other things, as we previously mentioned, and the food sensitivities themselves, which came first? Well, it's a tricky question, and it's one that we are really often asked, actually. And it's not necessarily a question that we often have the answer to. And this, again, is why testing the two together go hand in hand. We never assume, we never stop playing detective, and we never stop treating our clients as individuals. And this is where it's important to get the full picture. So very quickly then, why test food sensitivities? Well, we sort of tie this into exactly what I was just saying about the gut barrier and leaky gut and the sort of symptoms that you can see in clinic, in practice, that are associated with that gut barrier permeability. Very, very similar symptoms and health concerns can be associated with food sensitivities. So things, as you can see here, like weight loss and thyroid issues, digestive issues and skin issues, fibroids, endometriosis, PCOS, bone health concerns, brain fog, fatigue, migraines. And we'll give you some examples later. You'll see an example of a case that could very easily have been written off as hormone imbalances, but actually had everything to do with food sensitivities and compromised gut barrier function. So I know what you're probably thinking. Food sensitivity, do I really need to test food inflammation? Not sure it really has a place in my practice. We hear this all the time. Perhaps I just want to test the gut barrier, and you can do that, by the way. You can order the gut barrier panel separately as a standalone or actually as a retest, which I'll go into later as well. And you know, we do hear this a lot, and it's important for us to talk about it because actually we agree with all of these points. Apart from elimination diets are the gold standard, we don't agree with that, and that's where testing comes in. And we agree with all of these things because most food sensitivity tests only test IgG, which is problematic. And the reason it's problematic is because, well, there are three reasons right here. There are a number of reasons, but three of the biggies are right in front of us now. So first things first, IgG antibodies are found in healthy adults. So they most likely reflect exposure, not necessarily reaction. Okay, so recognition, not necessarily immune response. High rate of false positives as a result, and that down the line invariably results in unnecessary dietary restrictions. And when we're talking about the health of the gut overall, the last thing we want to do is put in too many unnecessary dietary restrictions. Not only can it be miserable and a long process for your client, but it's also not ideal in many cases to be cutting out entire food groups in terms of the health of the gut microbiome. And we know that the gut microbiome and gut barrier health go absolutely hand in hand. So rather than just testing immune recognition, we test inflammatory response as well. And we do that by not only testing IgG 1 to 4, and this is for the food sensitivity testing, so the FIT test and the gut barrier panel, both test IgG 1 to 4. We also test complement. So it may be a little while since you last had a lesson on the immune system. For some of us, a long, long time. For some of us, not that long at all. But I'm sure we all remember a little bit about complement proteins. And really, These are the proteins that go along with downstream inflammatory response, so that immune reaction, not just immune recognition. So with our test, we've got the benefit of seeing IgG alongside complement. And then as I'll show you, as we get into the gut barrier panel, we also look at IgA activation as well. And what this means essentially is that we're able to interpret the test findings within a broader context of each patient's clinical presentation. So we've got much more support of that presentation. And I can see that Charlotte's putting a little bit more information around this in the chat for you. So just to recap then on the immune system, again, I'm not going to spend much time on this at all, but we do have these 3 levels of defense, and the FIT and the gut barrier panel test all of these. So we go right from barrier immunity into innate and adaptive immunity by testing IgG, complement, and IgA at the same time. In terms of the foods we test, these are they. I appreciate that this is very small on your screen, particularly if you're watching on a phone. I apologise, but you can actually see it on our website. There are 3 versions of the FIT test. All 3 of them come automatically with the gut barrier panel. The only difference between them is the foods and additives that they test. So we've got the FIT 22, which tests 22 items, the FIT 132, which tests 132, and the 176, and I'll let you guess why it's called the FIT 176. In summary, these are they. And the FIT report itself looks like this. Okay, it's dead easy. It works on a traffic light system, and it's been created so that it's very, very quick and easy for you to look at and decipher what to do. We are massive fans of making your or helping our part of your clinical practice run smoothly, quickly. We don't want to take loads of your time. Time is really, really short in practice. And so the reason the test has been devised to look like this is to help that, to make it very, very quick and easy for you to see. And as a result, it's actually very quick and easy for your clients to understand as well. So it's color coded, it's friendly for you and your clients, it's easy to interpret. And as you can see here, we've essentially got these 3 categories. We've got red, orange, yellow. All of these foods are reactive in your client. They have stimulated an immune response in your client. The red to the greater degree, then we go to orange, then we go to yellow, stimulating to a slightly less degree, but still stimulating an inflammatory immune response. Okay, so that's really important. You'll also see that the other foods tested will come up in green. Green meaning nothing to worry about at this point in time. So just to recap, that easy interpretation then, highest immune reactivity being red, right the way through to dark green, no reactivity, safe to consume. So what does the gut barrier panel look like? Well, some of you will already know, because I know that lots of you that are on the webinar today have already done a gut barrier panel. But if you haven't, or you need a little recap, this is what the gut barrier panel looks like. Now, as you can see, we've got this great sliding scale here, going literally from negative, meaning no inflammatory response or no immune recognition response, through to red being a positive response. Okay, and we test these 4 markers, which I'll go into in a bit more detail in a sec: Candida, zonulin, occludin, and LPS, lipopolysaccharides. Now, the reason we've got these sliders is that our gut barrier panel is unique, and it acknowledges that leaky gut actually occurs across a spectrum. I don't know if you can see me here. I've just become very aware that I'm doing lots with my hands. I hope that's not distracting. But we We acknowledge that it occurs on a spectrum. It's not just a case of you have leaky gut or you don't, you have permeability or you don't, you have degrees of. And this is what the gut barrier panel will help to show you as well. And as I mentioned, for each of these markers, we're testing IgG 1 to 4 and complement and IgA 1 to 2. So let's talk a little bit more about those markers. Before we do, I'm just going to very, very quickly check the chat to make sure I haven't missed any questions before I fly on. Okay, it looks like we've had a question, but Charlotte's answered. Thanks, Charlotte. Okay, so let's get into those markers then. So first up, we have Candida, something no doubt that we're all very familiar with. As you know, it's a naturally occurring yeast. It resides in the GI tract as part of the normal microbiome. Candida itself is not problematic unless we have an overgrowth, and it's really, really important for us to remember that. We measure and use any Candida overgrowth as part of the gut barrier panel. And we show it as a precursor to leaky gut occurrence, okay? So zonulin then is next up. This is a marker of intestinal permeability, okay? So zonulin is involved, it's protein involved in keeping those epithelial tight junctions tight. We use next generation zonulin IgG antibody screening. So we're testing for zonulin antibodies in the gut barrier panel, not the zonulin protein itself. This is a much more stable marker. It's much more specific and it is exclusive to KBMO and it is different to the zonulin marker that you might find in a comprehensive stool analysis. It was actually developed by Dr. Alessio Fasano. He discovered zonulin and he was the one that partnered with KBMO. And all of his work was done on blood markers, all of it. And actually, zonulin was never intended to be tested in stool because it's much more, as I say, stable and specific when we test it in blood spot. Dr. Brent Dorval, if any of you are wondering, he was the guy that developed the first rapid HIV diagnostic, and he consulted Fasano's team. Another very, very, very clever guy. So in terms of occludin then, that's our next marker. This is a marker of intestinal tight junction stabilization and barrier function. So occludin, you have zonulin and occludin that very much work together as tight junction markers. So elevated occludin, that indicates that the tight junctions between those intestinal epithelial cells are breaking down. And then finally, lipopolysaccharide, so LPS. This, as many of you know, is a potent endotoxin. It's present in the outer surface membrane, the outer casing, if you like, of gram-negative bacteria, many of which are pathogenic. And if you'd like to learn more about LPS, actually, we have some great webinars about this on our website. If you go to kbmodiagnostics.co.uk, click on education, you will find some webinars there. We've got a great webinar called Lipopoly What, which gives you a great baseline knowledge of lipopolysaccharides. And then most recently as well, we've also got a webinar on there featuring Kat Smith, which is about the association between LPS and endometriosis. So loads to learn about lipopolysaccharides. We're not going to go into that today in any detail, but there's a lot more education there if you need it. Any queries, just let us know. So I think it's about time if we don't have any questions on that. And if you do, again, you can come off mute anytime. Just let me know or pop a question in the chat. Let's look at some real client reports. Now, before we do, there's a few things that I want you to have a think about when you're looking at them. And they're exactly the same things that are really important to think about and bear in mind when you are approaching doing a gut barrier test for one of your clients. Really, really important. So some things to consider then. How strong is your rapport with your client? Will you need to negotiate with them? So some basic, for starters, some basic therapeutic relationship stuff. Do you have a suitable relationship in place to be able to work off of the back of the results of the gut barrier test with your client? How will you decide what you're going to do with them? Why are you doing the test? What are you hoping to see? And I say hoping. We're going to go into a little bit more detail on that in just a second. How will you coach them? What's the clinical context? And really importantly, are there any client-specific contraindications as well? Now, this will vary a little bit as to whether we're thinking about the fit test element or the gut barrier element, but things like disordered eating, things like clients who are already eating a very restrictive diet, for example, clients that perhaps have fairly intense health worries for whom testing and different results may give them even more worry. It's really important to bear all that in mind. But the most important things we would say to you all day long, don't look for things that give you an excuse to treat. That's not a great reason to do a test of any kind, not just the fit test or the gut barrier panel, any test at all. Okay, it's really, really, really important that you're not actively trying to make the data say what you want it to say. Okay, really, really important. And also important to recognize that your client is unique. So any protocols, and I use that term loosely, any protocols that you might pop in place based on your client's results, they require personalization. They always require personalization. There is no one blanket protocol. And we get asked this quite a lot. So for example, on support calls, we might be asked by practitioners, well, okay, my client has come up very, very positive for LPS or Candida. What protocol do I need to put them on? What supplements do I need to give them? And the answer is, it depends on your client. Now, we can give you some guidance, and I'm going to show you where you can find that in a little while. But please, please remember that your client is unique, and everything that you do off the back of the testing needs to be personalized to them. So first up then, let's talk about Anna. She is our first client. And as I say, all of the following that you're about to see are real people. And I'm putting the synopsis up in front of you for Anna right now, because as I alluded to before, there are many symptoms associated with both food inflammation and gut barrier permeability that are often associated with other conditions, other issues, and to the kind of exclusion of thinking about food sensitivities and the gut barrier. Okay. And what you'll see with Anna is that many practitioners' minds may initially, and this isn't wrong, this isn't bad, nothing at all, it's just something that I want to show you. A lot of practitioners may look at Anna's case and go, this is a classic hormone imbalance, classic postmenopausal, maybe we need to run a, urine hormone metabolites, maybe she needs to go on HRT, maybe start going down the hormone lines. But I want to show you what we did with Anna from a food inflammation and gut barrier perspective. So for the benefit of those of you that aren't watching the webinar today, I will just read out a little bit if you're listening in the background. So Anna is female, she's 47 years old, and she's postmenopausal. She actually a couple of years ago went through surgical menopause due to adenomyosis and endometriosis. She's got a history of anxiety and controlling behavior around foods. Her symptoms that she came to us with were postprandial bloating, constipation, reflux, brain fog, generalized fatigue, joint pains and frequent headaches. She's done a lot of prior testing, actually, and everything has come back either negative or all within normal range or completely unremarkable. And that includes SIBO testing, which was negative, H. pylori negative, GI 360 stool analysis, nothing really of note there, various blood tests, and also her celiac test came back negative as well. In terms of diet, she's actually reasonably healthy. She doesn't drink any alcohol. She hydrates herself really well. She's eating balanced macros, very little sugar, and her lifestyle is good as well. She's got low reported stress and she does get daily exercise. So let's have a quick look, first things first, at what her fit test looks like. This is the only client where I'm going to show you their food inflammation results as well. So this is what Anna's results looked like. In terms of red, most, what's the word I'm looking for? I would say extreme. That's extreme is an extreme word, but her most inflammatory reactions, probably a better way of putting it, are to wheat. So both gluten, gliadin, and whole wheat. She's also got a reaction there to cabbage and also collard greens and paprika. And actually, again, when we look at the kind of hormone, liver health, etc. element of this, it's not great that we see these green veggies come up. Not ideal, but fortunately, there are lots of others that we can work with. So I can see some questions in the chat here. I will come back to those just after I've finished showing you Anna's details. They're great questions. So Anna's gut barrier panel, what does that look like then? Well, it looks like this. So I'll give you a sec just to have a look at it. Again, for the benefit of those of you that aren't watching on screen, we have a positive IgA 1 to 2 result on zonulin. And we also have a candida result that is literally just on the cutoff of negative and positive, but it does just fall into the negative category. What were you expecting is worth thinking about as well. So as I say, these are the things that we're looking at most of all. I can see, thanks Charlotte, I can see Charlotte's answering some of your questions in the chat at the same time. So we've got these little markers that have drawn our eye here. Everything is well in the green. We're not even looking at those. We're not worried about them. So what I want to talk to you now about is what they mean. So essentially, as you look at the gut barrier panel, you can see the markers that we're testing down that left-hand side, and each marker goes in a horizontal strip, okay? So the result for Candida is that top strip left to right. The result for zonulin is that second strip left to right, and so on and so forth. Now, what I'm going to do is start actually on the right-hand side. So let's look, for example, at that zonulin positive response. This is zonulin antibody as detected by IgA antibodies, okay? And these IgA antibodies indicate short-term immune activation. So the way we describe this is the warning signal, okay? So this is, we have the start of a little bit of an issue here, and if we don't get on top of it, then we may have a bigger issue. So it's kind of like the tsunami warning. Yeah, it's kind of like there is possibly a tsunami on the way. We're not entirely sure. Get ready. Okay, get ready, mitigate it however you can, that sort of thing. Bit of an extreme kind of analogy, but it's kind of the same thing. So this is this short term. This has not been going on for particularly long if it's coming up at IgA 1-2 level. And this is immune activation, okay, within the blood, obviously, because we're testing serum. IgG 1 to 4 and complement. If we see markers on this side, this is longer term systemic. This tells you that you do have a longer term systemic issue in terms of immune response. to those markers. Okay, hopefully that makes sense. Great, thanks. I can see Charlotte continue. Charlotte's absolutely working really, really hard at the moment. I can tell on the keyboard. Keep absolutely going for it. Thank you. Great questions, everybody. So a little bit just to recap. C3D, because that's the difference here. This is not, as I said before, it's not just IgG. We're testing C3D, which is one of the kind of downstream products of complement activation. It's an inflammatory metabolite, which is where we say if this is detected, we know we've got an inflammatory picture. And essentially it indicates that pathway activation in response to immune complexes. So we know that the immune system is working in terms of these particular gut barrier markers. Hopefully that makes sense. So where do we start when we're looking at Anna? What do we do now? Where do we start? That's the question we often get. What now? Great results, what now? Well, first things first, we look at the thing that needs action straight away. So this is actually a fairly straightforward gut barrier panel because we only have one thing that's come out positive, okay? Yes, we have Candida just coming up to the cutoff. We're going to leave that, okay? First things first, it's negative. And the reason that I keep saying this about the Candida is because it's something that we get questioned about a lot. It's on the cutoff. Should I do something about it? It's on the cutoff. No, if it's still green, you don't need to do anything. And in actual fact, something to bear in mind here is that we have this sliding scale. The reality is, if you've never tested this client before, you don't know which direction these arrows are actually even going in. So the temptation is to go, oh my goodness, that arrow's moving up. You know, so for example, that zonulin arrow or that candida arrow, oh, it's nudging into the red, it's going up into the red. Well, actually, we don't know that. It could be coming down versus previous months, and you don't know unless you've tested before. And this is why, and I'll loop back to this shortly, we recommend retesting as well. If you're testing a client's gut barrier panel, gut barrier with the gut barrier panel, you then make a series of recommendations. They follow a plan off of the back of it. We'd recommend that you test again to know, you know, what is happening at that point. Symptomatic presentation wise, they may give you a clue as to how they're doing, but it's always really good to retest. And actually retesting the gut barrier on its own is really, really cost effective. So where do we start? Well, it's sort of like a game of top trumps. Here, it's really, really clear. We've got one thing to work on. This is zonulin. That's the positive thing. But even if we did have candida, let's say it was nudged slightly into the positive, we've still got zonulin as our main issue. Those gut barrier proteins themselves, they're always top trumps. Okay, we need to know that that gut barrier is nice and tight and not leaky, and that is always our main concern. The other reminder as well that candida overgrowth, you know, think dysbiosis in general. So while this isn't showing you nothing in terms of what you can see in front of you, it's not showing you nothing in terms of candida, it's showing you that it is, you know, it is on that sliding scale. Perhaps we do need to think about a little bit of dysbiosis in this picture. Okay. So in terms of what we did then, well, food-wise, we put in place the exclusions as per her fit test results. So we excluded those foods for a period of time before slowly reintroducing them. Healthy replacement of gluten was key because, as you're well aware, it's you can be as problematic going with gluten-free options as wheat options in some cases because they're full of so much rubbish. We increased to polyphenols and fiber. This is where I talk about bearing in mind that we may have a level of dysbiosis in this picture, and we gave her as much variety in those fibers as possible. In terms of lifestyle, she already said, her lifestyle was very good, her stress was low. However, we did address that eating housekeeping. So making sure that she was chewing sufficiently, she was limiting water at meal times, mindful eating, that sort of thing, and really focusing where she could on increasing sleep quantity. In terms of supplements, we did give her a couple of supplements. She had the ones that you can see on screen there, both from Nutrigyne, GI Integrity Peach Tea, and fiber. So again, we've got a supplement to support that gut barrier and that positive zonulin antibody response. And we've also introduced a little bit more fiber as well. And again, just a little reminder, don't assume Candida is the problem just because it's there. Be really careful with your hand grenades. And by what I mean by that is we can be a little bit guilty, some of us sometimes, of going in quite heavily with antimicrobials where we see anything like this, okay? And particularly where we see things that perhaps are a bit more comfortable, familiar to us in practice. Just be really careful with that stuff because, as we know, in certain circumstances, when not done right, it can actually exacerbate that potential dysbiosis picture that we see. So just quickly checking the chat. Charlotte's been amazing at answering you all. Yeah, really great point. Charlotte here. I've had great success with gut barrier support and not antimicrobials or antifungals. Yeah, for sure. And we're going to talk about, very briefly, touch on very shortly, our remit as well and our focus, because I think we very often get drawn into supplements as well. So let's look at client 2 then. So client 2 is Christine. She's 69 years old, female, and she's got prior breast cancer history. The symptoms that she's come forward with are severe allergies, histamine intolerance, fatigue, anxiety, and celiac disease. You can see that her gut barrier panel here looks slightly different. There's no sliding scale, and that is simply because the sliding scale is a relatively new, this year, introduction to the KBMO gut barrier panel. Previously, we just had negative or positive. Now we can see here on Christine's results is that she's got positive IgA response for Candida, zonulin, and occludin. We don't, as I say, know on the sliding scale where she is, but we do know that she's having an inflammatory response, okay? 7 months later, after being looked after, she did the gut barrier panel again, and you can see that we had some really great success. Nothing is positive anymore. Everything is now in that green negative section, which is really testament to 2 things. One is her plan and the kind of protocol, inverted commas, that she followed and was recommended, and the other is testament to her commitment to following that plan as well. And the latter is really important. And you remember, it was one of the considerations to think about when you're considering testing with your client of any kind, not just this test. So in terms of the approach that helped get her in 7 months from positive to negative, she continued her gluten and dairy-free diet. She's got celiac. She's going to continue this gluten-free diet. She was put on some gut healing supplementation that you can see there, as well as some digestive enzymes. And actually, just on that, what I do want to say is that in the FIT test, what we are testing is food sensitivity, not food intolerance, as it pertains to issues like digestive insufficiency, so low digestive enzymes, low betaine hydrochloride, and that sort of thing. That is a separate issue, and that potentially may come up. And again, we do have questions about this from time to time. Well, my client, doesn't seem to be able to tolerate this food group or this type of food, but it's not showing up in their fit report, well, that's the point at which to go, okay, well, clearly there's not an immune response, an inflammatory immune response to that food. However, there is still an intolerance from a digestive perspective. So that's the point at which you go through your tick list and you go, right, okay, maybe we're looking at low digestive function or something like that instead. Or indeed, as we said, you're looking at a dysbiosis picture and that's exacerbating it. I digress. So progress at follow-up, all her gut barrier panel markers were negative. Her energy was much improved, digestion and her allergies were much improved. And interestingly, her HbA1c improved as well. And as I say, this was full testament to her as well. She fully adhered to her plan and she had really strong motivation as well. She had prior breast cancer history and didn't want to be in that position again. Next up, we've got Mark. He's client 3. Okay. Again, you can see his gut barrier panel here. Mark's is significantly more red than Anna or Christine. He's 30 years old and fair to say he was probably feeling pretty miserable at this point. His symptoms presenting were an ulcerative colitis flare. He had loose stools with urgency, horrible fatigue, poor exercise performance, and increased CRP as well. 11 months later, his nutritional therapist had managed to bring his gut barrier panel markers all back into negative, all back into the green, okay, which was fantastic. Now, it was really interesting because at the Gut Protocols event in London last week, when I showed everybody this slide, I could see some of the faces at this brilliant transformation, but the fact that it took 11 months. Okay, it is really, really important to remember and also to coach our client through the fact that very often this level of, as you can see in Mark here, this level of gut barrier dysfunction, this level of leaky gut, if you will, doesn't happen overnight. It just doesn't happen overnight. And therefore, as with a lot of other things, and you're well versed in this, I know, it can take a little while to fully turn back around as well. And so 11 months later, he was in a much, much better position. His symptoms had resolved completely. His energy was really strong. His digestion was normal. Interestingly, his HbA1c improved as well. And massively, his ulcerative colitis flare had fully resolved without steroids. And it's really important for me to say here, not doing the steroids, not taking the steroids for this flare was his choice, not the nutritional therapist's choice. Okay, that's out of our remit. But he was in a much, much, much better position. And as you can imagine, full adherence to his protocol because he was so miserable to start with and strong motivation. You're not necessarily going to see that with every single client. And that, is important when we talk about retesting as well. Bear with me one sec. I'm just going to check the chat for any questions. Okay, let's have a look. So Charlotte has addressed, thanks Charlotte, the cost of the gut barrier panel retest is £75 instead of the usual £100 for the gut barrier panel alone. Just one thing to say on that, it needs to be done within a 12-month period max of your initial gut barrier panel, simply because if you do it outside of that time period, that's not really a retest. That's you starting all over again with that client, really. So long as it's within 12 months, that's fine. The gentle Andy, good morning. What's the gentle anti-candida protocol that has been used? That will be really specific to that client, which is why we haven't put it on here Okay. Remember me saying before, it's really, really important that it's personalized, and we'll come into supplements in a sec. And as Charlotte has said in the chat, we do refer our practitioners to some of the supplement companies that we trust and we really rate as well. And I can show you where to find that information. Yeah, time frame for the retest is within 6 months. That's gold standard, absolutely. Let's have a look. What herbs were advised, same thing. The reason we haven't gone into detail is because that would be specific to your client, but we can help you with that as and when you come across it and point you in the right direction. Why would occludin be positive but not zonulin? Great question. They're different proteins. So zonulin has to do with the tight junctions being together or pulled apart. Okay, so zonulin antibodies will appear where you have, right, I'm going to do this now. This is going to look really bizarre. But I hope you can see that on your screen. So this is my epithelial tight junction, okay? I can't see you through it because it's completely tight. There's no permeability. When it starts to become permeable, starts to become leaky, I can see you through it. Now it's zonulin that will appear, zonulin protein antibodies in this case, that will appear as those tight junctions are being pulled apart, okay? So zonulin's function is tight, keeping those junctions together. Occludin has to do with the integrity of the gut barrier. So if you think about, for example, those kind of the fingers, if you will, keeping the tight junctions together, but also everything, every epithelial surface, occludin will appear as a marker when you start to get breakdown of those surfaces. Does that make sense? Hopefully that's answered that question. So they both have to do with gut barrier integrity. They're just different components of it, if that makes sense. Let's have a look. Sorry about this, guys. Okay. I think I've got everything there for now. We'll come back to the chat in just a sec, just in case I haven't. Okay, so, well, we've started talking about it already, so we may as well elaborate more. Let's talk about gut barrier support then. So we've already alluded to not kind of panicking too much, for want of a better way of putting it. I'm really kind of thinking about how we're going to approach this logically, sensibly, in a way that, you know, is going to be doable for your client, is specific to your client. But it's also really important to bear in mind your role. You know, the vast majority of us on this webinar today are nutritionists and nutritional therapists. So it's really important for us to go back to our roots, if you will, and think about how we can prioritize food first, food and lifestyle. So what can we do here for the gut barrier? Well, we can do a ton for the gut barrier without even thinking about supplements. Supplements have their place. We'll come back to them in a sec. Firstly, optimize dietary fiber. Okay, the best thing you can do for your gut barrier is to keep that layer of mucus across it, basically, that protective layer of mucus that goes right through the GIT tract and protects that epithelial barrier. Okay, use the dietary fiber to feed the microbes so that they don't eat your mucins and get to that intestinal barrier level. Polyphenol rich diet as well, the berries, pomegranates, black currants, green tea, cacao, and the gut supporting nutrients as they appear in foods, not necessarily supplements straight away. So is your client getting essential fatty acids? Are they getting B vitamins? Are they getting zinc, etc., through food sources? Also mucopolysaccharides, GAGs, and you can find them. You can see on the screen here where we find these. We've got our flax, our aloe, oats, etc. All the good stuff that we're really well versed in and we're good at. Okay, don't be afraid to really pull on those and do those with your clients. That's what you're amazing at. Address food sensitivities and food mediated inflammation, because as we said before, that's really important. And actually it is this little chicken and egg situation whereby we're like, well, are those food sensitivities, those food inflammatory reactions going to not really help that gut barrier integrity and helping heal that gut barrier, or vice versa? We don't always know. So it's really, really important to address any food mediated inflammation too, and put in your lifestyle measures like mindful eating, have a, as that pertains, as we know, to digestive function, for example, stomach acid production and that sort of thing. And then, because we know that it massively affects the health of your gut, things like stress reduction, sleep optimization, breathing techniques, all of this stuff you can do without even having to reach for supplements. But when you do need to reach for supplements, that's absolutely fine. And we can help you with that. So again, if you go to the website, kbmodiagnostics.co.uk, you'll see here, you can see you've got a navigation panel across the top. Education is there. If you click on education, you're going to see an option that says supplement recommendations. And within that, you'll find some of the supplement recommendations for the various gut barrier panel markers from some of the supplement companies that we respect and we trust, and think that they can help you with. So for example, you'll see them list for LPS, this is the supplement, or these are the supplements that you might want to think about. For Candida, you might want to think about these. For zonulin and occludin and that tight junction integrity, you might want to think about this. For LPS, you might want to think about this. And what you can always do as well is you can then schedule a call or follow up with them directly if you want to go into detail about making that bespoke for your particular client. So just having a quick look on the chat. The chat is busy today. You're keeping Charlotte super busy. Okay, we've talked about exclusions. Charlotte has quite rightly said, again, just for the benefit of those of you not able to see the chat right now, any foods that come up in light green on the fit test, just ignore those unless your client isn't getting better. If your client isn't getting better and you've taken out everything else and you're trying everything else, then it's worth perhaps experimenting with those, but just ignore them in the first instance, unless you reach that point. If you do reach that point, as Charlotte has mentioned, book a support call with us and we'll help you out if that's the case. We've got questions answered on sugars, bugs, mucilaginous foods. Okay, all right. Thanks so much, Charlotte. We've got all the questions answered, I think, so far. So we've touched very short a few times on retesting. There we go. We've got it. I'm sorry, I think I froze there. So in terms of when to retest, we recommend ideally retesting after 3 to 6 months. That makes most sense in most situations. And there will be times, what I've shown you today are examples of where the gut barrier panel has improved, and things are moving in the right direction. That won't always be the case, and there'll be a number of factors for that. And actually, just going back to a couple of the webinars that I spoke about earlier, Kat's webinar on LPS and endometriosis gives a couple of good examples of where those gut barrier panels appeared to get worse before they got better. So what if you don't see changes or they get worse? What do you do? Well, as we say, see the previous food sensitivity considerations, because that may be a factor. Consider actual client compliance. Are they actually 100% with complete dedication following the plan that you have given them? Okay. Consider where you are in your support protocol. Could it be, for example, that let's say you're working on LPS and you have seen that LPS looks worse after 3 months than it did previously? Have a look at your plan. Have a look at your recommendations. Do you by any chance have biofilm disruptors in there? Is there a possibility that you are freeing all the little bugs, ready to, kill them off, wipe them out, technical terms, and actually you're just right in the middle of that process right now? Have you disrupted biofilms, so therefore the current position looks worse, but you're working on it and it is about to get better? For example, there are a number of instances like that may be a consideration. Consider increased stress or any other lifestyle or health factors. 3 to 6 months later, when you retest, is your client's picture the same? Is their stress level the same? Is their home life the same? Have they started taking any new medications? Are you in exactly the same position with that client? Are you comparing apples for apples at that point? If you're really seeing no changes, or they're getting worse, and you are ticking, yes, I've done that, I've done that, I've done that, I've done that, to all of the previous points, consider then running a stool or a SIBO test if you think it's relevant and the kind of presentation suggests that might be useful. And also never forget to consider GP referral or GP involvement if at any point you have any red flags, or if something just doesn't feel right in all of this as well. We must never forget about involving the GPs where it's relevant. In terms of clinical support then, well, there's lots of it if you need it. And I said before, what we try and do is make the tests themselves and the reports themselves as self-explanatory as possible for you, as easy to interpret and read as possible, so that you're not having to waste your time trying to, speak to somebody else, talking to us. We love to talk to you, but it's also precious time that you could be seeing clients. So we try and keep you as kind of self-serve as possible, in the hopes that that's the best possible thing for you. But we do have clinical support there. I've mentioned the website a number of times. You can see the provider handbook in front of you there on your screen. That's also on the website under education, as well as videos, webinars, leaflets, supplement protocols, etc., etc. And of course, we do have support calls. We're very, very happy to speak to you if you need us. In terms of your clients, well, they're up to you. We don't deal with your clients, okay? We literally support you and you support your clients, okay? So we don't do any support calls with your clients. We don't reach out to them, nothing like that. They're your client, they belong to you. But what they do have as part of the fit test and the gut barrier panel is they have access to a mobile app, okay, which gives them their results, etc. So that if they're on the run and they need to remember what they shouldn't be eating when they're out with friends, for example, they can see it there. And there are some food suggestions and things like that as well. So all in all, really, the whole thing together, whether you choose to do the fit test with the gut barrier panel or you simply do the gut barrier panel, whatever is most relevant for your client in your practice, we've got a really, really powerful tool here when it comes to investigating leaky gut and investigating it as a potential trigger or mediator of your client's presenting symptoms. It's really, really useful as a pre-initial consultation screening tool. So for example, in my clinic now, when I see my clients, I do it before even our initial consultation. So that I literally, I have a consultation later this week. I've already got her results back. It gives me a real head start on my first set of recommendations for her. It's data that you can use straight away So you've got this immediate clarity. It improves client engagement and compliance. They've got something in front of them there. Then we know clients love a food inflammation test report. They love to see what is and isn't problematic for them at that time. It's not a so what test. It's insightful. It's useful. As we say, you can do things off the back of it straight away. And the reports are really concise. You can just hit the ground running, basically. And then last but not least, in terms of the cost of the reports, as I say, we don't interact with your client, you do. That means that you can essentially make a practitioner markup on the test of your choice. Whether you choose to do that or not, completely up to you. Overall, then, just to recap, I think it's fair to say that the gut is the foundation of systemic health. You know, we go right back to the Hippocrates quote at the it's the foundation of systemic health. It influences immune regulation, detoxification, hormone balance, brain function, and essentially the gut barrier panel allows you to kind of identify this hidden dysfunction behind these other presentations, behind these other health concerns, including this level of silent immune activation. And as our friends at Human put it, Human use the gut barrier panel a lot. You cannot repair what you haven't measured. Gut barrier testing gives us that window and the data to guide true healing. So I'm just going to check the chat for any more questions that are unanswered at the moment. But if you do have any yourself, please feel free to come off mute and fire away and let's get them answered for you. Okay, so as Charlotte has mentioned, specific introductions of supplements, when, where, how much dosages, etc. We referred those sorts of questions to the supplement companies. And again, have a look at the resources on the website for those. Let's have a look. Okay, so somebody else sharing advice. That's lovely. Thank you. What is the minimum age for the tests? Well, in theory, and I know that Charlotte can't jump in here verbally because we were having some problems taking her off mute earlier. But
no, I've fixed it,
oh,
Emily.
Perfect. Perfect. Hi. Yes, I mean, in theory, what I was going to say, in theory, there's no minimum age, but from a practical perspective, there are considerations, aren't there?
Yeah, so I did actually answer in the chat. And when it comes to the age or the age range, we don't have a specific age range. I think the only thing I would say is use with younger children cautiously because the immune system's a bit jumpy. It's designed to be jumpy for a reason. So you need to interpret the results quite carefully. We've got loads of practitioners using the panel with children, especially in the US, where there are lots of pediatricians using it in all ages and getting great results. So I think if you are testing on children, it's probably best to check in with us and book a support call and we can help you.
Perfect. Thanks, Charlotte.
No worries.
Hopefully that answers that question. And it looks like we've answered all the other questions on the chat as well. So just one final shout out for anybody that would like to ask any other questions. Hopefully today, who do we contact regarding access to the app? So if you're having any issues with your client accessing the app or anything like that, you're very, very welcome to drop us an email, ukoffice@kbmodiagnostics.com. So any questions like that at all, just drop us an email. We also have a WhatsApp group that you're very welcome to join and kind of ask questions and queries in any time. But yes, any questions at all, we're here for you. And so is the education part of the website. So it's been lovely. I haven't been able to see you today, but it's been lovely having you here with us. Thank you very much. We do have another webinar next Tuesday. And actually, interestingly, that is a webinar on Candida. So keep your eyes peeled, keep yourselves glued in to your email inboxes, because you'll get an email from us later this week about that, and hopefully we'll see you next Tuesday and we will deep dive a bit more into Candida at that point. Thanks everybody.